Thank you. Good afternoon. The title of my presentation is From Weakness to Wellness, Core Strength in Moms and Seniors. I'd like to recognize my co-contributors, Dr. Samuels, Drs. McCoy, Duncan, Applebaum, and Pizzella. So let's see what happens. These are my disclosures. So the technology that we're talking about this afternoon are two. HIFM, which is electromagnetic muscle stimulation, which results with induction of brain-independent supramaximal muscle contractions, which results in muscle growth, as well as what we all know as radiofrequency, which heating of the fat and muscle tissue, you can get tissue neovascularization, as well as apoptosis of fat tissue. When you combine these two in a synchronized fashion, you can target both the muscle and adipose tissue, leading to strengthening the muscles and reducing fat. We know that the core muscles, the abdominal and pelvic floor muscles, play a key role in proper posture as well as the pelvic floor being crucial for both bladder control as well as sexual function. The impairment of core muscles, we know, increases the potential for injury and leads to decreased quality of life. We know that standalone, non-invasive electromagnetic muscle stimulation or HIFM therapy reinforces the pelvic floor muscles, and we can combine this with RF to approach the abdominal muscles. So the aim of our study was to investigate the effect of both standalone pelvic floor stimulation and combine that with abdominal wall stimulation, looking at core muscle strengthening and quality of life measures. So this is our methodology. I took exception with the title of the older group as elderly. I would classify those as senior. But there are 39 in that cohort, and ages 60 to 79. BMI, as you can see, 19.7 to 33 with skin types 1 through 5. And the other group was with post-delivery female patients, ages 27 to 44, BMI 19 to 34, skin types 1 to 4. And the key is they had to have delivered within 6 to 60 months to be enrolled. The treatment was 4 abdominal muscle treatments once a week and 6 pelvic floor stimulations. The primary outcome measures were core strength, core muscle strength measured with a pressure biofeedback device, and secondary measures or outcomes were waist circumference, comfort, and a satisfaction questionnaire. You can look on the right of the slide and you can see that there is a schematic with a pressure plate under the lumbar area, and the patient will contract their abdominal muscles and they'll get a measurement in millimeters of mercury pressure. These are the primary outcome results. On the left, you can see our senior patients with baseline, after treatment, 1 and 3 month follow-up, and you can see there was a 33.7% improvement in strength. In the postnatal female group, there was a 25.2% increase. It's important to note that if you look at the starting point of both groups, it's clear that the baseline was much higher in the postnatal female group. Secondary outcome measures, there was gradual and significant reduction of the core waist circumference, about 3.1 centimeters in the senior group. There was reported high comfort following treatment, over 76% agreed or strongly agreed. It was very comfortable treatments. In terms of the satisfaction questionnaire, 89% stated they could get up easily from a sedentary position and felt that it made their core stronger. 76% of the patients were able to perform their daily duties, they felt with better outcome, and 92% satisfaction, and patients said they would certainly recommend it to their friends. When you look at the postnatal group, similar results. There was a reduction of waist circumference of 4.6. There was a high comfort report. Patients were very satisfied in terms of all women were able to perform their daily duties without any issues. They could all spend time with their family and do the normal routines around the house. And 97% felt that their core strength was much stronger. This are a couple of photographs of patients treated. This is one of our study patients, a 60-year-old female with a BMI of 22.5. 3 months following, her core muscle strength had doubled from 45 to 90, and her waist circumference had dropped 2.5 centimeters. One of Dr. Samuel's patients, a 33-year-old female, a 3-month post, her strength increased from 104 to 160 and had a reduction of her circumference of her waist of just over 11 centimeters. So in conclusion, the study showed there was an increase in core muscle strength in over 33% in the senior group, With 25.2 in postnatal patients, there was 0 to mild discomfort reported in both groups. The outcome of the study showed the effectiveness of abdominal muscle stimulation with combined HiFM and RF, as well as the pelvic floor stimulation with standalone HiFM. There was strengthened core muscles that led to an overall improvement in quality of life measures, and this confirmed also the safety of the treatments. Thank you.